Thank you, Ceann Comhairle. Minister, I'd like to ask the steps that you and your department are taking to improve monitoring and oversight of disability services, and if there are plans to introduce statutory authority to audit disability standards, and if you will make a statement on the matter. Thank you.
Thank you, Deputy. Thank you, Ceann Comhairle. One of the central principles and opportunities of the transfer of functions was to ensure a legally and operational robust governance framework that provides for appropriate budgetary and performance management of specialist disability services delivered by or on behalf of the HSE. The legislative framework in place since the commencement of the Health Miscellaneous Provision Act 2022 is underpinned by a suite of cooperation and reporting arrangements to provide for a close collaboration between my department, the HSE, and the Department of Health. Responsibility for delivery of these specialist services remains with the HSE following the transfer. Importantly, the HSE has its own governance arrangements in place with individual service providers and continues to implement and monitor these on an ongoing basis. In relation to the quality standards, the Health Information and Quality Authority, HIQA, is an independent authority established under the Health Act 2007 to drive continuous improvements and to monitor safety and quality in Ireland's health and personal social care services. The Health Act 2007 requires all providers, public, private and voluntary organisations, to identify residential services that meet the criteria for a designated centre and to apply to the Chief Inspector within HIQA to have those centres registered. Separately, the Minister for Health is currently developing a regulatory framework for home support providers with the aim of ensuring that all service users over 18 years are provided with high-quality care. It will comprise primary legislation for the licensing providers, secondary legislation in the form of regulation, minimum requirements and HIQA national standards. In relation to the disability day services, the HSE has implemented a continuous quality improvement approach within adult day services since 2019 through voluntary interim standards for new directions, and the interim standards are based on a framework devised by HIQA closely aligned to the new directions policy. Deputy.
Thank you, Minister. Well, I welcome your statement there, and I know how you work with all the different departments, including HIQA. But if you look at it, Minister, we're hitting a crisis, and at the moment, if you look at the paying conditions for Section 39s, it's absolutely after causing within the different departments. I also believe we need to look at recruitment, but there's just one case, Minister, and I want to thank you for your work on it, and this is just an example of this, where you have allocated, and the Department of Health are allocating funding for a particular gentleman to go into a kind of a service, or what would be a service provider, a home, and the service providers, who absolutely do an excellent job, are telling me that they have no workers, that they will not be able to facilitate this man because they have no workers. And Minister, while I know, and I can only say to yourself and Minister Roger O'Gorman, the work that you have done, and I know your commitment, but we are now, I believe, hitting a crisis. And if we do not get our Section 39's paying conditions sorted, if we do not get the proper funding in place, and if we do not have staff to recruit, Minister, I know this is something that falls within both of your remit, but I just think, because I'm panicking now, because this man is meant to be going in shortly. Thank you.
Thank you, Deputy, and you hit on a number of key elements there, but I think the core element that you speak about and speak to is in relation to the recruitment and retention crisis that our health and social care professionals and providers are facing. While I hear what you're saying in relation to our Section 39s, I don't think it's unique to our Section 39s, the recruitment and the retention. I think it's right across the board. I think the Section 38s are experiencing it, and I also think that the HSE are experiencing it, but not to the level that the Section 39s are. Myself and Minister O'Gorman are working tirelessly to work the levers of all our colleagues within government to press on this particular matter. And to be honest with you, Deputy, there's none better placed than your good self when it comes to forcing the hand of any minister that sits in this front row to actually exercise the need for the support and the vital support that we need to bring to bear for our Section 39 colleagues.